Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, the debate over how to handle the nation's health care continues in Washington, D.C. But while lawmakers hash it all out, for now, the Affordable Care Act stands. And that means that Nevadans are still required to have health insurance, whether they get it from their employer or buy it through the exchange. And a lot of things have changed since the last open enrollment period. Janelle Davis and Heather Korbulik from the Silver State Health Insurance Exchange are here to talk about all those changes. Thank you, ladies, so much for coming on the show.
Our pleasure.
All right, now when last I had this topic and we discussed this issue, things were not in quite so much flux as they are now. Just describe for me what the situation is and, how it's working right now.
I would say that right now we're looking at a similar scenario that we had last year. Yes, there's been a ton of rhetoric around the repeal and replace of the Affordable Care Act in Washington, D.C., and that's caused some disruption for Nevada. But on large part, things are mostly stable here. We've seen year-over-year growth in our enrollment. We're prepared for our next open enrollment period, regardless of the challenges, which we can talk a little bit more about. And we're looking forward to building on our successes this next year.
Okay, so we'll start with some of the big changes that have come to the exchange recently. The biggest one, I think, or at least the biggest scare, was when all the insurance companies pulled out of the rural counties in Nevada. So we're looking at 8,000 Nevadans who weren't going to have an option for insurance, and then Centene comes in and they're now offering some plans for the rural. So tell me about that.
Well, that was a dramatic day in our office when we found out that Anthem plans had determined that they were no longer going to participate in our rural communities, and it was a real gut punch for our state. We thought that there would be coverage, and then there suddenly wasn't. We were down from one carrier to none, and so we had an unwavering governor who's been committed fully to making sure that all Nevadans have access to health insurance, and so he used a lot of his capital to make sure that Centene or Silver Summit joined our state and provided health care plans out in those rural areas. We also looked at a variety of different options during that time, including state flexibility that we might have, leverage in our own communities, and then really kind of searching through the most worst case scenario and what that would look like and how we could find safety net resources for consumers in those areas. Luckily, we were able to find a plan.
Now, we're not out of the woods yet. I mean, obviously, there's a huge effort on Capitol Hill to repeal the Affordable Care Act. So what is the worst case scenario, and do you guys have a plan in place?
Well, we have a plan for 2018 where we have two different carriers who are going to participate all across the state, only one in our 14 previously Bear counties. And we're looking at right now the next big hurdle and the next big kind of uncertainty is around rates and what those are going to look like for our consumers. There's a lot of uncertainty coming from Washington, D.C. around whether or not they're going to pay what are called cost-sharing reductions, which are a form of subsidy that help people help drive down the costs for out-of-pocket costs in terms of deductibles, co-pays, and prescription costs. So if those aren't paid, and if there isn't a commitment from Washington, D.C. to have those paid, then we'll likely see a bigger rate increase for our consumers all across the board. But it's important, and I think Janelle and I talk about this a lot, it's important for consumers to know that when your subsidy or when your premiums go up, well, almost 80% of Nevada consumers have subsidy through the exchange. And so for those individuals who are receiving subsidies, those subsidies go up with the premiums.
And I don't think a lot of people or Nevadans know that they are eligible for this subsidy assistance, and that's financial assistance to help offset that monthly premium. So even though premiums go up, and they do even before the Affordable Care Act, that financial assistance also goes up. So that's something that we would like to talk about and
make sure consumers understand.
Make sure they understand that they are eligible for this.
Okay, so when we talk about the things that have actually changed, there's been obviously a lot of talk about what could change and what the administration wants to change, but what has actually changed that Nevadans need to know about?
I think the biggest change that we're seeing for this going into this open enrollment, which is our 5th open enrollment, is the truncated enrollment, so a shortened period of time. So before we had 90 days for folks to enroll. Now that's cut in half, so folks only have 45 days to enroll. So open enrollment begins November 1st and it only goes through December 15th. So we really want to push the message to look at your plan. Even if you have a current plan right now on the exchange, shop the marketplace and get in-person assistance. Insurance is extremely complicated and confusing, and there's a lot of uncertainty floating about, and we're still here, and Nevada HealthLink is here to help those individuals who maybe need health insurance or are looking at a plan more appropriate for their budget and family needs.
Why the shorter enrollment period?
One of the first things that Secretary Tom Price did when he took over the Department of Health and Human Services was created a market stabilization bill. And so part of that bill included a truncated open enrollment period or a shortened enrollment period. I think the purpose or the intent was to try to align it more along the lines of Medicare's open enrollment period. But unfortunately for the exchange, that created a lot of new hurdles for us to jump through or over.
Do you guys anticipate these new hurdles reducing the number of Nevadans who have health insurance through the exchange?
I think there's several things that will potentially reduce the amount of Nevadans who are accessing insurance through the exchange, although I'm hopeful that that's not the scenario. One of them is the shortened enrollment period. The other is that our plans have changed and rates have gone up. And so it's really key for people to know that subsidies exist and that those subsidies go up with the premium costs. But I think for people who are not able to afford or who are not eligible for those subsidies, the prices are becoming out of their ability to access and ability to afford. So I think that will potentially impact our enrollment numbers. And then, finally, we have so many different shifts in terms of whether or not the federal government is going to enforce the individual mandate or the tax penalty. So if there isn't a lot of enforcement around that, people who are generally not sick will likely forego getting insurance.
And that makes costs go up for everyone.
It does.
Okay. So I have to ask, is this trend that we're seeing of premiums going up, which we've seen this happen now a few times, and insurance carriers pulling out, which hurts competition and also drives costs up, is that something that was happening already and likely would have happened no matter what's happening in DC, or is it largely a product of the instability when it comes to whether it will all be repealed in DC, so insurance companies are just too spooked?
So rates have gone up every year over year prior to the Affordable Care Act, and then consistently year over year during, throughout the Affordable Care Act's era. But they were more around the amount of about 8% a year. What we're seeing this year is a little bit unprecedented in terms of giant increases in rates. And that has a lot and almost everything to do with instability from our federal government, whether it's around the cost sharing reductions being paid or whether it's around the enforcement of the individual mandate. All of that uncertainty is creating an environment that's very volatile for our carriers, and their participation in insurance is all about understanding your risk. So if you don't understand your risk and the market becomes so volatile, it becomes unbearable to remain in the business.
And we are hearing that from insurance companies.
Yeah.
Is that, are you continuing to hear that from them, that, I'm not willing to reach out and provide more coverage to more parts of the state because I might not get, people taking me up on that?
Both Prominence and Anthem, who've left the exchange this year, have cited the federal instability and the uncertainties as a reason for their exit.
So what's your best advice then to Nevadans who are looking at this going, I don't really know whether I should spend the money if I don't want to, or if I'm going to get penalized, and what is the penalty this year?
The penalty remains the same. So just as last year during an open enrollment, if you didn't enroll in a health insurance plan and you had no health insurance, it was $695 per individual, or 2.5% of your yearly income, whichever is higher. And so that law still exists. There is some ambiguity surrounding that concept and law, but it's still in place, and it hasn't changed. So I think Nevadans are realizing the importance of having health insurance for themselves and their family, and we're really all just one accident away from claiming bankruptcy, and so we need to be including this into our budget because we never know what could happen.
Are you hearing from Nevadans who are really concerned about the loss of their health coverage?
We're hearing from a lot of Nevadans who are concerned about the loss of their carrier, of their insurance provider, and whether or not they're going to have comparable plans on the exchange, which to me says more how critical it is for people to shop with an enrollment professional, get free in-person assistance, take a look at the plans that the plans have changed, prescriptions have changed, providers and networks have changed. So it's critical that people sit down and understand what they're purchasing.
And this is everybody, not just new people to the process. That's the people who have to renew, which everyone does, right, every year?
Correct.
If they don't go through that process and shop the marketplace, they will be what's called a crosswalk to a different plan or a similar price plan. But again, we just really want to enforce the importance of shopping the marketplace because like Heather said, the plans have changed, the prices have changed, and that happens every year, unfortunately.
And don't procrastinate because we've got less time to get it
Yeah,
done.
less time.
Okay. Obviously, open enrollment it starts November 1st. Can people peruse their options before that?
There is an opportunity to plan, compare, or to read, or to look at healthcare.gov and take a look at the different plans and compare them a couple of weeks in advance, but really there isn't any advanced shopping. You really do need to go sit with an enrollment professional during open enrollment to choose a plan.
Okay, and how do they get more information?
I would go to nevadahealthlink.com and check out our all of our events that are going on right now. We will have a kickoff and a closeout event November 1st and December 15th. That'll be an opportunity for folks to go enroll, get that in-person assistance. We will have navigators and brokers that we partner throughout the community statewide where they can call, make an appointment. We have an in-person assistance tool located on nevadahealthlink.com, and we will be revamping our homepage too so they can easily navigate through that.
Okay, and we'll get those links on our website as well. All right, we are out of time, but ladies, thank you so much. I really appreciate you guys coming on the show.
Thank you for having us.
All right, well, coming up on Face the State, we all know about our First Amendment right to free speech, right? But how much does it actually protect? And what type of speech can still land you in hot water or cause you to lose your job? I'll sit down with an attorney to find out right after the break.